Good afternoon, everyone. This is Dr. Avinash Desousa, consultant psychiatrist here, and I'm here to talk to you today about a very pertinent issue in autism. That is certain myths and facts related to autism. The reason we're having this webinar is because over the years, when I have met parents and I have met teachers and I have met grandparents of children with the autism spectrum disorders, there has always been a concern about uh, various people holding various beliefs with regard to why autism occurs, what autism is, what are the factors that lead to autism, how do you handle autistic children. And so there are a lot of thoughts prevalent. Some of them may be scientifically correct, some of them may not be scientifically correct. So it's very important that we are able to sort of decipher what is right and what is wrong with regard to autism. And that's why we are having this webinar on speculations about the myths and facts of autism. One of the biggest myths that I have always seen parents come to me and tell me is that there is a particular treatment or a medication that has a cure for autism. Now, it's very important to realize that autism and autism spectrum disorders is a condition that is lifelong. So you're really not going to be able to get a cure for autism. Rather, we have cures for various behavioral issues that you may see in autism. So the myth is that there is a cure for autism. There is no cure. A person lives with autism spectrum disorders throughout his lifetime, and he may have to probably consider medication for behavioral issues. If he has epilepsy, he may need medication. If he has other problems like, say, anger issues, or he has sensory issues, he may need some medication. But the bottom line is that the autism cannot be treated. The autism spectrum disorder is not treatable. So we don't have any medication for autism spectrum disorders. The medications are only for the behavioral issue. One of the second myths that we have with autism spectrum disorders is that it's more common in boys, so it's very rare for girls to get it. Now, the answer here is it's definitely more common in boys, but it's not rare for girls to get it. So we have seen any number of girl children and any number of girls with autism spectrum disorders. In fact, in the older classification of the autism spectrum disorders, which was called pervasive developmental disorders earlier, we used to have a disorder called Rett syndrome. And Rett syndrome was a syndrome of autistic features and gait disturbances, etc., which was specifically seen in girls. So autism is seen in girls. It's not that it isn't seen, but due to certain reasons, the prevalence is far more in boys. So if you say it doesn't occur in girls, that's a wrong thought. A third myth which is prevalent is that autism always comes with low IQ. And a lot of people think that autism means the child will also have intellectual impairment or mental retardation, as we used to call it, and the IQ will be low. But the answer here is that the fact is that autism may not always have low IQ. So, in my experience, around 60 to 65% of children with autism spectrum disorders have low IQ. Around 30% have normal IQ, that is 90 to 110, which is a normal IQ, and they are educable, trainable, etc. And you have 5% that have a very high IQ. So you have three groups of children with autism spectrum disorders: some with a lower IQ, some with a higher IQ, some with a normal IQ. Higher IQ group is the lowest, the rarest, but you do have normal IQ children with autism spectrum disorders. Another myth which is prevalent with regard to the autism spectrum is that it is caused by certain viral infections, and there is a myth which is the MMR vaccine theory of autism, which has been proposed by a number of researchers. So they believe, the myth was that they believed that giving the MMR vaccine probably induced the infection, the autism infection, the MMR infection, and that caused autism. The answer here is, the truth about this is that the MMR vaccine doesn't cause autism. Most theories and researchers have proven that the MMR vaccine is not linked to autism. So I've seen many parents of children with autism spectrum disorders who refuse to medicate their children with the MMR vaccine for the very simple reason that they feel that MMR is a causative factor for autism. And I always say that no, that's not true. The MMR vaccine is very safe. A lot of children, I think all over India, all children take it at 9 months of age. And it's not that everyone develops the autism spectrum problem. So I don't think the MMR is a causative factor at all in autism. Another myth which is prevalent is that autism is similar to schizophrenia, and that's a totally wrong myth. In the 1940s, there were people who used to sort of equate autism to childhood onset schizophrenia, but today that doesn't hold true. We have a large number of uh, theories, scientific papers, etc., that have very clearly distinguished that the two are separate conditions. So, autism and childhood onset schizophrenia are no longer linked. Um One thing which is there is that they are two separate disorders. Childhood onset schizophrenia is a very separate disorder with psychotic features like delusions, hallucinations, etc. Whereas autism spectrum disorders, we all know, is a disorder where you have social isolation, lack of eye contact, and speech deficits. Though one thing is there that sometimes psychotic features may be seen in children with autism spectrum disorders, though the two disorders, that is autism and childhood onset schizophrenia, are not linked at all. Another myth that is prevalent with regard to the autism spectrum disorders is that speech defects are always present in autism. The answer here is wrong. Speech defects are not always present in autism. Some may have speech which is quite proper, and social communication may be fairly to an extent that it can be managed. So, not all children with autism may show social communication deficits. Though it is a hallmark of autism, all children may not show it. What happens is that some children are able to speak and they speak well, though they may have minor deficits in social communication which are present. This is in keeping with our earlier diagnosis of Asperger's disorder, which was there in DSM-4, wherein the thought was that Asperger's is a condition wherein you have features of the autism spectrum, but speech and communication is intact, and speech is well developed. So one thing here is that not all autistic children definitely have speech defects. Some of them may have speech which is very well developed. Another myth which is prevalent with regard to autism is that autism comes up because of certain deficiencies in diet and vitamin deficiency. Again, this is something that hasn't been proven. We do not have any conditions of autism which are caused by vitamin deficiencies. We have no conditions of autism which are caused by dietary deficiencies. So you do not necessarily have to give a lot of vitamins, or you do not necessarily have to give dietary supplements to sort of get rid of autism. No, it doesn't work that way. You primarily just maintain the regular diet, and you don't necessarily sort of go on to giving them extra supplements as a cure for autism. Another myth which is prevalent very often is that you will see changes very fast in autism once you start therapies. So a lot of parents come to me and say that we have started occupational therapy and special education with a particular therapist, and it's been probably 2 weeks or 3 weeks, and we are seeing no changes. So a lot of people feel that the changes that you see with therapy have to be very fast. Whereas the fact is that therapy, whether it is occupational therapy or special education, both take a very long time for us to see changes. So we would need to give whichever therapist is in question, whether it is the occupational therapist or the special educator, at least a good 3 months time to work with the child, so that we can sort of help the child develop. And for you to see sustainable changes, you would need at least a 3 month period of therapy. And regularity with therapy is very important. Only when you see regularity with therapy and the same therapist working with the child over 3 months diligently, that you would see certain changes in the child. Another thing which is often spoken about autism is that the reason children with autism are born in certain families are because these are probably the myth that is prevalent is that these are due to certain misdeeds you've done in your past life, and your karma has caught up with you, and that is the reason these children are born to you. The answer is that is totally scientifically baseless. It is something which is totally auspicious, and I don't think we have to believe in those kind of reasons for autism. Autism occurs due to various probable genetic, probable neurochemical, and probable brain-based factors. So, autism is not something that you get in your family because you have sinned in the past, or it is not something that you get because of being hurt. I mean, or for having hurt someone or because of your past misdeeds. No, these are not something that you get. Another myth which is prevalent is that autism can improve with traditional healing, Reiki, and certain religious practices. At the outset, let me tell you that as a doctor and as a professional, I have nothing against religious practices, and I believe that we all must follow the religion that we adhere to. I have nothing against prayer. I have nothing against healing through prayer. I have nothing against Reiki either. But scientifically, prayer, healing, and Reiki do not act as cures for autism. They may provide some amount of psychological solace to the parent. They may provide some amount of faith and belief in the minds of the parents, and who may feel a solace that a particular person from the community has prayed over their child, which is welcome. But to think of it totally as a cure for autism would be wrong. Another myth that comes up is certain people come and tell me that will certain brain surgeries cure autism? The fact is that there is no brain surgery available at all for autism, because we have not been able to pinpoint to particular areas of the brain, or autism is not caused by a tumor of the brain, or it is not caused by certain deficits in the brain that lead to the autism spectrum disorders. So there is no brain surgery that can probably lead to a cure for autism. It is not possible at all. So we don't have any brain surgery that can work in that direction. Rather, the only way out for autism to work, to be treated, is through rigorous therapies and medication if needed. So that's where we come from. Another myth which is prevalent is that Ayurvedic medications and homeopathic medications have a cure for autism. And the answer here is also wrong. There are no cures for autism in Ayurveda and homeopathy, because while certain Ayurvedic medications may improve cognition by around 10%, certain homeopathic medications may improve focus and attention by around 10%, but we really don't have Ayurvedic and homeopathic medications that can provide a cure for autism. Not at all. There is no cure for autism in these fields. Also, feeding your child who has autism spectrum disorders huge amounts of chavanprash and other Ayurvedic items may not necessarily bring about a cure. In fact, number of chavanprash preparations have got heavy metals, and large amounts of those heavy metals, when probably given, can cause a problem. At the same time, I would say giving anybody 1 teaspoon of chavanprash a day is not going to cause any problem at all. It may not cause any effect. It may not cause any side effect. But if you look at it as a cure for the child who has autism spectrum, it is something which is totally baseless, and something that I would say uh, you shouldn't be believing in. Another myth is that the larger the number of doctors we visit, and the larger number of opinions we take, and the larger number of consensus we get, probably the child will improve faster. Here we have to understand this, that it's important that you have faith in that one doctor who you visit. It is important that you give that one doctor time. It is important that you, like the therapist, you also give the doctor a good 3 months time, work with the child, medicate the child, understand the child, so that you see effects. I am not against you visiting other doctors. So if you do take second and third opinions, it's fine for your own satisfaction. But it's very important that you do not mix medication of 2 or 3 doctors. Very important that you do not mix opinions of 2 or 3 doctors, so that the child shouldn't suffer in the long run. That is something which is very important and very vital. One of the other myths that comes up with regard to autism is that autism comes up because probably the mother did not want the child, and this was an unwanted pregnancy that the mother had. And this theory was put forward in the 1930s by certain psychologists called Bruno Bethlehem, who said that cold, aloof, and refrigerator mothers was a term he had used, who don't like their children, tend to make autism develop in the children because they do not speak to their children. This theory has been done away with, and there is no reason to prove it. Most mothers who have children with autism spectrum disorders have always wanted the baby and always wanted the pregnancy, and they still have had a child that has had autism. So it's not necessarily something that I think holds true in the modern era today. So that myth myth that autism comes up because the mother really rejected the child and did not want the child is something which has been done away with. The fact is, all mothers want their children. It's sometimes a little unfortunate that some mothers give birth to a child with autism spectrum disorders. And that goes through for any other developmental disability, not forsaking the fact that it is something that can be managed, though with a lot of effort and a lot of struggle. Another myth which is prevalent is that parents of children with developmental disabilities now have to lifelong forget about their own happiness and give all their time to their children because the children need them. Uh, and this goes through for autism spectrum disorders also. The answer here is parents of children with autism spectrum disorders need to give time to their child, need to spend time with their child's therapists, need to spend time with their child's teachers, but it doesn't mean that they stop living a life. It's very important that you find time to do things that you want to do. It's very important that you find time to enjoy yourself. It's very important that you find time to go out without the child also. Do all the personal things that you wanted to do because this is something which is very important for the development, personal development of the parent as well. The parent's mental health is also very important. Otherwise, what will happen is if you're spending all your energies on the child with no time for yourself, a certain amount of depression, a certain amount of anxiety, a certain amount of anger can creep in, and that may make the parent feel helpless, hopeless, worthless, and they may need to seek help psychiatrically or psychologically for the same. One of the myths which is prevalent with regard to autism is that um, autism is caused more from the father's side rather than the mother's side genetically. The answer here is autism may be a genetic condition. When I say may, because we do not yet know any particular gene that causes autism, we do not yet know any particular genetic factors that lead to autism, though some genes have been identified and are being researched. Autism cannot be blamed on one parent, that is the father or the mother. Neither can developmental disabilities be blamed on one parent, that is the father or the mother, because you have genetics that plays a role, but both parents contribute 50% each to the development of a child. And I think it would be morally wrong to probably blame one parent, for the birth of a child with autism spectrum disorders. Many mothers in India have borne the brunt of being blamed of not being able to provide a child that has been normal. They have been mistreated at times and they have been insulted at times. And I think it's morally absolutely wrong and it's very tragic if mothers are blamed or fathers are blamed for the birth of a child with developmental disabilities. Another thing that I want to bring also to your notice is that when we look at the myths and facts related to autism, it is also important to know that many people come up with newer therapies which they claim would work for autism. There have been trends of hyperbaric oxygen therapy. There have been some trends of stem cell therapy. There have been some trends of newer therapies coming up every now and then that have been proposing a cure for autism. The fact is, these are new therapies which are under research. No studies have proven their efficacy totally. That goes for stem cell, that goes for dietary therapies, that goes for hyperbaric oxygen therapy. Though they are based on certain theoretical constructs, they haven't been able to prove a cure for autism. And these are expensive therapies. So my advice to parents would be that be cautious when you're looking at these therapies for your child. Please speak to your doctor concerned, take his opinion, take one or two more opinions, and then take your call whether you want to go for such treatments or not. A myth with regard to autism is that my child will never be educable, he will never be trainable, he may never learn anything. The fact is, no, children with autism spectrum are as educable and trainable as any other children, and they need an inclusive setup. When we mean an inclusive setup, they need a setup that is open to their idiosyncrasies and a setup which is open to their handling and a setup which is open to understanding them. And we've had examples of children with autism spectrum that have been doctors. We've had examples of children with autism spectrum that have gone on to do PhDs, that have gone on to study further. And it's only that people around them have to be aware of the autism spectrum and aware of how to sort of handle them. A myth which is prevalent is that children with autism have no emotions. This again is a myth which is wrong. children with autism spectrum disorders have a lot of emotions. They have emotions just like you and me. It's just that sometimes they may not be able to understand those emotions. They may not be able to dissect and tell you the difference between feeling sad, feeling low, feeling disgust, feeling unhappy, feeling upset, feeling angry, feeling short tempered. So they may not be really able to tell you the difference between the two. But what is very important is that they are very much emotional. They may not cry very easily, they may not emote very easily, but it's also important to know that they do have emotions because they have the same brain as you and I have. The brain may be wired a little different, but they do understand emotions and they do understand feelings, though they may not be able to express their feelings. So for them, sometimes saying I love you or saying good morning is one of the same. They may say it in the same tone, and that emotionality and change of tone may not happen. So it's something that one has to be a little aware of. Another myth with regard to the autism spectrum disorders is that children and adolescents with the autism spectrum disorders do not have any sexual feelings or desires. The answer here is it's wrong. They have a body, they have the sexual and reproductive organs in their body, they attain puberty, they do well, and therefore they would have sexual feelings, and hormonal changes also happen in their bodies. So it's very important for parents to realize that they do develop sexual feelings, but at the same time, they may not really be able to express their sexual feelings. They may not be able to convey what they are feeling. They may not be able to decipher where they should behave in a manner which is sexual, where they should not behave in a manner which is sexual. So sometimes they may display some behaviors which are sexually inappropriate, but otherwise they do have sexual feelings just like anyone else. Another myth with regard to autism spectrum disorders is that as soon as girls with autism spectrum disorders start menstruating, and if they menstruate for a large, a fair amount of time, and they are unable to manage their menstruation, then a hysterectomy should be done. The answer here is that hysterectomy should not be done for every child, girl child rather, with autism spectrum disorders, for the very simple reason that the uterus and the ovaries being there is very important for their hormonal development. And it's important that uh, uh, the hysterectomy is not carried out unless there's a dire need or there's some major gynec problem, or the menstrual cycle has, people are unable to manage the menstrual cycle, and there are factors over there which are leading to this. Then I think in such cases you may consider a hysterectomy after looking at various factors which are there. A myth is that if I have a child with autism and I get him married, he will also develop autistic children. Again, this is something which hasn't been proven. We've had children with the autism spectrum get married and they've had normal children. We've had children with the autism spectrum get married and they've had children without developmental disabilities. So they very well can have children that are normal. Another myth which is prevalent is that they should never be married. The answer here is there is no right or wrong with regard to marriage and adults with autism spectrum. Rather, the marriage has to be planned looking at various individual factors, various personal factors, various social factors, various psychological factors, various financial factors. And it's only after considering all this on a case by case basis can a decision of whether an adult with autism spectrum should marry or not marry be taken. So that is something which we have to look at with a great deal of caution, and it's not some decision that can be taken very easily. Another myth which is prevalent is that autism spectrum disorder adults may show criminal tendencies. Now, there is no scientific evidence to prove that adults with autism spectrum disorder show criminal tendencies. They may get a little more aggressive, they may get a little more demanding, they may get a little more violent at times, but there is no evidence to show that they have criminal tendencies which are far more compared to other people. No, they behave in fairly the same manner as all adults do, and I don't think there's any reason to believe that they have criminal tendencies in them. The last two myths that I'm going to touch upon before we sort of go into the question answer session, which I feel is very important. The first is that a lot of people believe that is autism is a neurological disorder. My take on this is a little different, and I say autism is a neuropsychiatric disorder. It isn't a neurological disorder alone. So the reason being, it is brain based. It also has psychological factors which are at play. Children and adolescents on the autism spectrum may show tendencies to which brain based, in the sense that they have brain based tendencies. So that means there are chemicals which are at play, and that's why it's brain based. They also display symptoms which are emotional and psychological, so they have psychiatric factors at play. So it is best that we label autism as being a um, neuropsychiatric disorder rather than being a neurological disorder, a combination of both the brain and the mind. The last of the myths that I want to bring about is that the prevalence of autism is increasing, uh, is what people are saying. Uh, One, I think autism was always there since the 1940s when Leo Kanner described it for the first time. It's just that now people are more aware, more people are coming early for diagnosis. The term autism and autism spectrum disorders and what it means is well known. The prevalence has increased a bit because of this awareness. So it had always been 1 in 100 to 1 in 150, and now it has come up to 1 in 60 or 1 in 70 because more and more people are coming forward, and that is why it's very important that awareness about autism be created. That is why we're in fact having this webinar. What I have sort of shared with you are a few myths and facts which related to autism. There are many more. There are many queries that I'm sure you will have. I have tried to provide you with a gamut of myths and facts which I felt are most prevalent, and I hope I have done justice. If there are questions, I will be very happy to answer them. I thank Autism Connect for having me here and calling me for this webinar. And I will now just look at some of the questions which are there and try and answer them. And if you have questions, you can post them, or you can, um, 1 minute, you can raise your hand. There is an option to raise the hand and ask a question, and then you could probably even um, unmute yourself and ask a question. I think that's how it works. Okay, someone has asked, how do they do intelligence testing with a non-verbal child? The answer here is that intelligence testing in a non-verbal child, you have intelligence tests which are used for children who are aphasic. So when you have intelligence tests which are used for children that are aphasic, and for children who are deaf mute. One of them is known as the Collin and Revers intelligence tests, which is used for deaf mute children. So that is something that can be done. Vanny George asks me that will children with autism benefit from stem cell therapy? Well, I just want to say this, that stem cell therapy is still in the research phase. And if you ask me, it's very difficult for us to say whether children would benefit. So I wouldn't want to put my money on stem cell therapy, because I feel it's something that I would rather spend on occupational therapy, remedial, and other therapy. How early can autism be detected is what Mansimran Sethi has asked. The answer here is that autism can be detected as early as 8-9 months of age, 1.5 year of age. So that is something that can very easily be done. Um, Someone has asked, Kashit has asked, that what is the best way to get a confirmed diagnosis of ASD? My student from 3 to 14 years has been getting a diagnosis of ASD. The only way out is you undergo a proper assessment using proper rating scales. A team of a psychologist, psychiatrist, pediatrician, um, occupational therapist will assess the child and then probably diagnose. So there may be inconsistencies of diagnosis, but using proper formal rating scales and testing, you can definitely diagnose. Meenal wants to know about the comorbidities of autism. The answer here is that you do see ADHD in children with autism. Around 30 to 40% of children with autism show ADHD, and that is something which is very difficult to handle at times, and you may need medication at times for that. You may need other therapies for that. Autism and learning disability don't go hand in hand, because for a diagnosis of learning disability, you need to rule out any other developmental disability. So that is something which is very important. Um, Alicia has asked that I'm aware that parents follow a lot of diets which don't generally show results, and there is no proof of the same. Apart from the keto diet and the GFCF diet, what are the other diets? There are some diets where metals have to be eliminated. There are some diets where canned food has to be eliminated. Frankly speaking, I do not believe in dietary therapy for autism. And the reason for that is that the keto diet and the GFCF diet have been shown to prove beneficial, but they don't fit into the Indian system of dietary allowances and the kind of food we have. And it's very difficult because the supplements that come for them are expensive, and you may not be really able to follow that lifelong. To what extent does hypersensitivity to light, sound, etc. affect daily functioning is what Rujuta asks. It depends from child to child. There are some children that are very sensitive and get affected very easily. So you need to have dim lights, less sound, and multiple other things. But you have to also work on it from an occupational therapy perspective, from an auditory and visual therapy perspective, and you will see changes. Donna wants to know, is it good to give sedation medication to ADHD children and explain the underlying physiology? Well, Donna, I don't think we give sedation medication to children with ADHD. We have medication for ADHD. In my practice and my experience, we have given medication which has worked and worked brilliantly without sedation, because the child has to be able to pay attention and focus. So if you're having sedation with your medication, your doctor needs to probably readjust it and then look at the dosage. Judhajit Panigrahi says, how can we distinguish between a child with autism and ADHD? Well, ADHD children are hyperactive, they are impulsive, they do not sit in one place, they get restless, they may get aggressive, they may get uh, violent at times, they may forget things. Whereas we've already told you that the key features of autism are social isolation, poor eye-to-eye contact, social communication, speech defects, which are there. Rafiq Ali wants to know the genetics and the chance of the next sibling to be autistic. Well, there are certain genetic factors that have been implicated in autism, Rafiq Ali, and we really do not know what causes autism. So, if you ask me, the chances in the next sibling is less, but nevertheless, I would say that you visit someone and get genetic testing done and genetic counseling done to sort of determine the same. Can IVF cause autism? Is what Surekha has asked. The answer here is that, Surekha, it is well known that children with IVF, born out of IVF rather, are more prone to developmental disability. So one has to be careful when you are undergoing an IVF, because this is an offshoot of that does happen. What are the special good characteristics of an autistic child is what Judhajit asks. The answer here is, well, I think all autistic children are good and special. So I don't think I would want to name special characteristics, but I think some of them are very good academically, some of them are good in music, some of them are good in certain other abilities. So you have to find out what's good in your child. Unnati wants to know that in the lockdown period, how do we control these children at home because they want to go out? Well, there are a large number of activities which can be done at home. And in fact, Autism Connect is going to have me for another webinar where I'm specially going to be speaking about what activities can be done with children at home during the lockdown period and to keep them busy even if school is not on, and particularly again in the vacation where school may not be on. Uh, Sangeeta wants to know, as a pediatrician suggests a nutrition is necessary for brain development, how does nutrition not be included in a factor influencing ASD? Well, the answer is nutrition is needed for every child, and I don't think nutrition is a cure for ASD. So if you feel you want to give some supplements to the child, you're welcome, but I do not think nutrition is a cure for ASD. How can we find the child having autism only at a glance? Well, Judajit, you cannot find the child having autism only at a glance. You need to sit with the child, observe the child, have a few sessions with the child before you diagnose. Unnati wants to know, how can we explain to autistic children about sexuality? Well, I think sex education can be done for special children just as we do it for the children. And it's something that I feel is very important and must be done. So you have special educators who are trained in that, who conduct these sessions for children, and parents can be trained also in the same. How important is intelligence assessment in children with ASD? It is important so that you come to know the IQ level. You may do it at post 6 years of age. You may not do it before that. A child in third standard does not give eye contact, keeps biting the nails, and answers only in a few words, shows all symptoms of autism. Is this social anxiety or autism? Asks Pooja Shah. Well, it's very difficult to diagnose on the basis of what you're telling me. One would have to see the child. One would have to go into a detailed history of the child, look into his behaviors, observe him, and then probably diagnose. Bhavana has asked about intelligence in a non-verbal child. I've already answered that. You have specific tests for intelligence in a non-verbal child, one of which is known as the Collin and Reverse intelligence test that can be done. Shivani wants to know that in an inclusion setting, how long does a child attend school hours? The answer here is that in an inclusion setting, school hours should probably be attended based on the child's individual capacity. You may start with 1 or 2 hours and gradually uh, extend. Um, Kiran wants to know that if in the pregnancy the mother takes certain medication, is there a possibility of the child becoming autistic? The answer here is certain medications and antibiotics have been implicated, but nothing has been proven. So I wouldn't really want to pinpoint that as a cause. People are saying that autism has increased because of the eating habits or way of living. I don't think so. I think a number of other disorders have also increased, like blood pressure, diabetes, stroke, lack of sleep, etc. So I don't think we can blame autism on lifestyle. Somya says, does excessive mobile phone usage cause autism? The answer is there have been people who propose that young children spending a lot of time digitally makes them socially disconnected, but proving them to be autistic is something that we have not yet reached. So I don't think I would sort of, go with that. Signs of early diagnosis of autism as early as 1 to 2 years of age is asked by Nupur. Well, Nupur, the children may not usually maintain eye contact. They are not socially very the type who mix. They do not like to be cuddled and held. They prefer to be aloof and they engage more in isolated play. The parent complains of a lack of parent-child bonding. These are some of the factors that you may see. Simon wants to know that ASD assessment is qualitative. Can tools like functional MRI confirm ASD? Well, Simon, functional MRI can only probably confirm some aspects of the brain functioning in ASD, but I don't think we've reached a stage where functional MRI is diagnostic for ASD. Um, Ishani Bhargav wants to know if autistic children how do they find a passion if they can't express themselves? Well, it's not that they may not be able to express themselves verbally, but they may be able to express themselves in doing what they are doing, and it's very easy then for you to ascertain what area of interest helps them. Nutan Bakri wants to know whether yoga can help autism. Well, Dr. Nutan, if the child is capable of focusing and paying attention and being able to do yoga, definitely yoga could help in certain factors. Yoga will not cure autism, but definitely improve certain factors in the child. How will we assess a child with deaf blindness if she or he is suspected of autism spectrum disorders? Well, in cases of deaf blindness, very frankly, uh, they do show some autistic features because deaf blindness causes a lot of sensory issues to them. So it's very difficult really to say whether the child has autism spectrum disorders. I would rather go with a diagnosis of deaf blindness rather than ASD in those children. Anu wants to know, is there a particular diet that is beneficial to autistic children? I have already answered that, Anu, that diets do not work with autistic children. We stick to the normal diet. We may refrain from some items, but it's preferably that they have a diet which is the same as everyone else. Rutuja wants to know, does stem cell therapy help? Because a parent come to me and they had been told that they would get 100% results in the child. Well, there are certain agencies that are promoting stem cell therapy, and Rutuja, sadly, it's wrong. I would not want a child to expect 100 or a parent to expect 100% result from stem therapy. It's a experimental procedure. It's under research. It hasn't been proven, so I would not advocate it. After the age of 14, rehabilitation options for autism kids in India. Vanny George wants to know. Well, Vanny, there are some centers that provide vocational development for children with autism. There are some centers that provide occupational placement. Based on the child, you will have to decide what suits the child. Momita wants to know, what are the chances of autism in twin children when one is diagnosed with autism? Chances are rare that you will have twin children with autism. You will have one child who may be having autism spectrum and the other child that may be fairly normal. Anjana Gauri says that parents abruptly stop therapy when they see improvement in the child. How do we convince them not to withdraw from therapy? The answer is, be very open and psycho-educate parents from an early age that they have to continue therapy for at least a 2-year period. You cannot stop therapy in between. Even after 2 years, to have sustained improvements, therapy has to be continued. That's the only way. Nutan said, since I said it's a neuropsychological disorder, can yoga be used? Yes, I did say it can be used and it is useful as therapy, and that's what answers Vijendra's question as well. Nasreen says, if an autistic child is treated in a cruel way, will it worsen its condition? Yes. Autistic children need love and affection as much as you and I need it. So if you have autistic children who are treated in a manner which is not proper and inhumane, it would definitely make them aggressive, it would make them hyperactive, it would worsen their condition. Can specific learning disability and autism spectrum disorder be comorbid? Well, children with autism spectrum disorders may show some features of learning disability, particularly in the normal IQ group, and it's very important at that time that both are assessed. What is the difference between ADHD and autism? I've already answered that, Somya, so I will not repeat that. Early signs, Divya, I've already spoken about in my earlier question. Jazila wants to know how early can IQ be tested in a child with or without ASD, verbal or non-verbal? The answer is I wouldn't do an IQ before the age of 6 as far as possible. Sana Praveen wants to know, is there a relation between parents' self-esteem and management of ASD? Sana, the answer here is that the more positive parents are, the more easier it's going to be for them to manage their children. So I think that's true for any child, whether it is a normal child or a child with special like autism spectrum. So parent self-esteem is very important. If the self-esteem is high, managing the child becomes very easy. Janvi wants to know, should a mix of psychiatric therapy and neurological therapy benefit the child with autism? I don't think there is anything like neurotic therapy and psychiatric therapy. I think one doctor, giving that doctor enough time is what is very, very important. Sunita, earliest age to detect autism, I already said is 9 months to 1.5 years. Carol wants to know, in an autistic child who's 10 years old and doesn't speak, can speech therapy work? 10 years is a little late, but I will still not lose hope. I would want a good speech therapist to work with the child for a good 1 year, 2 years before I say no. Sahili Mukherjee says that she saw a child diagnosed with autism spectrum at the age of 2.6, was non-verbal. When the child became 6 years old with therapy, there were no symptoms and again got diagnosed. Well, Sahili, children show improvement with therapy. So the symptoms they showed at 2.6 probably did not exist at 6, but maybe other symptoms existed which warranted the diagnosis of autism spectrum. Though you mentioned that autism affects more boys and girls, it's a myth. In reality, we see in our school more than 30 boys with autism and a few handful of girls. Yes, so the thing is, girls do get affected. And in our country, girls also get diagnosed much later. They aren't brought for therapy earlier because of a patriarchal society that sometimes exists. So we definitely see less girls. I just said it's not that it's only a boys' disorder. What is the difference between Asperger's and ASD? Srinivasan, in ASD, I've already told you all the cardinal features. But in Asperger's, you do see speech and communication which is intact. Can ASD lead to schizophrenia? Syamla, I have answered that in my lecture, but it's very important that in schizophrenia and ASD aren't linked, but you do see psychotic symptoms in patients with ASD. How do you ask a minimally verbal child with ASD to communicate? Is asked by Dr. Indu. Well, Dr. Indu, I think the child needs a very formal speech therapy evaluation, and then the extent to which the child can communicate can be dealt with. Sunita wants to know, how do you deal with an autistic child when he or she becomes wild? I don't think autistic children become wild, they get aggressive. They're not animals that are wild or domesticated. So do use your language a little carefully. I would say that it's important that if they are getting aggressive, please take them to a doctor, show them to a doctor, get them treated, start medication if you need to, start behavior therapy if you need to, and sort it out. Srinivasan wants to know, do many ASD children have sensory integration dysfunction? Yes, around 30 to 40% of them do have. Shivani asks, is autism not an environmental person context interaction? Well, we haven't really been able to sort of reach over there. Someone else asks, how do I distinguish between autism and social anxiety? I've already answered that. Social anxiety is when you're afraid of speaking in social situations, whereas autism is a whole gamut of symptoms I already mentioned. Vanishni wants to know whether watching too much screen time is responsible useful for autism before 3 years of age? The answer here is that it's a theory that has been put forward, but I don't think it's a causative factor which is there. Sudeshna asks, what therapy will be useful for social anxiety? Sudeshna, that's beyond the purview of our topic here, so I don't think I would answer that. Sana wants to know, how would you manage sexual behavior in children with ADHD? The answer here is, Sana, that we would have to look at what are the factors that are leading behavior, some amount of occupational therapy, psychiatric help, behavioral management, multiple things go into it. It would depend on the specific sexual behavior in context also. Donna wants to know whether medication would continue lifelong in children with autism. The answer is, usually we give medication probably for 6 months to 2 years, then we assess. In some children for 5 years, in some children it may continue longer. Malika Khimani asks, who does the diagnosis, clinical psychologist or psychiatrist alone? Well, I think the diagnosis is done by a team. So you have a special educator, you have a psychiatrist, you have a psychologist who are on the team. Sometimes a pediatric neurologist or a pediatrician may also help. I've already answered about sexual issues, and I've already answered about violent behavior. Someone asks whether the child is 6 years old and does not concentrate. Well, the child will have to be assessed. We really can't answer that on this forum. Based on the assessment, we will then have to decide what treatment and medication the child would need, what other treatments the child would need. Similarly, Sania has asked about treatment of social communication disorder with autism. It involves multiple therapy, a little bit of OT, speech therapy, remedial, counseling, everything together will go hand in hand. Someone wants to know how to compromise an autistic child if they're adamant in something. Well, this has been asked by Apu Dilippan. Well, I think you cannot compromise an autistic child. The word compromise would be wrong. Rather, you have to learn to manage your child. So it is something that I think you can only do if you learn behavioral management. So that is something which has to be done. Kashmi wants to know, can unethical and criminal tendencies be reduced by social skills training, or are more therapies needed? Well, Kashmi, that I think is again beyond the purview of my webinar. I mean, I will be very happy to answer that. If you go to my website and personally email me, I will be more than happy. Nabanita wants to know, what do we advise if parents with the child with autism ask whether they should plan a second child or not? I've already spoken about that. You need to look at genetic factors and then decide. DT wants to know, how do we break to a parent about ASD? It's very hard when the child has had normal level stages. I think breaking a diagnosis of ASD is like breaking a diagnosis of cancer or any other disorder. You have to be a little sensitive and break the diagnosis. Rather, you cannot not do it. In a COVID situation, how do you ask the ASD child to use a mask? The answer is, first, the mask has to be of something that the child is very comfortable with. Choose cloth that he's comfortable with. Make a homemade mask. The mask can have has to be of material that he's comfortable with, and the mask can also contain something fluffy in it, which will make the child feel very comfortable and not too sensitive. Can childhood autism later lead to schizophrenia? Veera, there are no studies to prove that, so we really don't know. According to your opinion, what helps an autistic child of mild to moderate degree? ABA versus psychotherapy versus CBT. I think ABA works better, Jazira. I would not talk about CBT really, though CBT has been shown to help, but ABT is something I would be more happy with. Does stem cell work? Priyambada, I have already answered that. Stem cell doesn't work children with autism. That's my personal experience. And you will not see 100% results at all. Some diets help in hyperactivity, asked Donna. And do I suggest? Well, I think diets don't help much. You have to work more behaviorally with the child. Any behavior therapy for children who hit themselves? Well, Leelavati, there is no behavior therapy for children that hit themselves. You have to divert them in other things, yes, but you may need to take a psychiatric opinion, and sometimes some amount of medication may be needed. What are the good scales to diagnose autism apart from observation? Asked by Upasana. We have the childhood autism rating scale. We have the ISA, the Indian scale for the assessment of autism, which can be used. Rafiq Ali wants to know the role of antipsychotics in autism. Well, Rafiq Ali, autism, we use antipsychotics primarily for the management of behavioral problems. So that's where their role is. They don't have a role in curing autism. Sneha wants to know whether children with autism can be cured. The answer here is they can't be cured, but they can definitely be treated and controlled. Amandeep wants to know that what are the accommodations that can be made for a child with ASD in the classroom. The answer is the child will want to sit alone, give him a separate table, give him a separate bench. If he doesn't want to mix with two children, give him a loop. The teacher has to be able to see him and manage him. He may sometimes talk out of turn, he may shout, he may shriek. The teacher has to be open to all that. The teacher also has to be open to the fact that sometimes the child may not cooperate, and so you have to sometimes go with what the child wants. Do you think a fast-track lifestyle leads to autism? Asks Elisha Sunavane. No, I don't think so. It doesn't help. It doesn't really lead to autism in any way. We've always had fast-track lives. Preeti wants to know, will speech therapy help on a virtual platform? You will have to try virtual and non-virtual both together. I can really say that it is very difficult to say whether it will help on a virtual platform. Leah says that some neurologists suggest an early diagnosis as long as young 3.5 to 4 years to accommodate therapies, and some who say diagnosis should be made after 7. What should a parent do? Well, my suggestion is I think 4 to 5 is a good amount of time for diagnosis. I normally say 6 years. That's something which I go with. How do we teach other people who are not in the psychology stream about how to interact with their children with autism? I think you teach them like you would teach any other parent. I don't think we have parents who are all in psychology stream, and you don't need to be in the psychology stream to interact with children who have autism. So I think you teach them like you would teach any other parents. Show them what you would do, and then ask them to repeat. Unnati wants to know any basic assessments for autism in the school premises. Well, you normally do your battery of tests. I don't think there's any other test. Nabanita asks me, what is a better test, CARS or ISA? I put my money on ISA. It's a far better test, and it's been used far more. Unnati Karia wants to know if the child shows inconsistent eye contact, not repetitive behaviors, but deficits in social interactions and obsessive behavior. Can we say these are ASD traits? These are ASD traits, but I wouldn't want to diagnose autism till I probably do an assessment. Sana wants to know what are the sleep issues in autistic. The sleep issues are some sleep more, some sleep less, some don't sleep at all, and some are drowsy in the day. So depending on what the issue is, we have to treat. How do we differentiate ASD from developmental delay? Shyamla, in developmental delay, the delays are there from birth and the milestones are delayed. Whereas if you look at ASD, they have a period of 1 year, 1.5 years of normal development, after which the problem starts. How do you manage the family of an autistic child if they are not empathetic? Asks Ishani. The answer here is you have to manage them by talking to them, educating them about the disorder. If they have a psychological problem, counsel them. So that's the way you go about it. Parajita wants to know, can autism be tested in pregnancy? Very difficult. And I don't think there is any specific test. Does art therapy help children with autism? Padma, yes, it does help. Do try it out. Dr. Vinay Kumar wants to know, how do you differentiate between sensory issues and behavioral issues? Sensory issues are when they are hypersensitive to touch, pain, pressure, light, sound. And behavioral issues are when they get aggressive, they don't listen, they get stubborn, they shout, they scream, and multiple other things. How much screen time should a child with autism have? Asks Ginny. Well, sometimes the screen might be the only companion that a child with autism has. So it would depend child to child, and you would have to decide on a case-by-case basis. Would sensory diet help ASD? Again, I'm not very fond of diets, but yes, sensory diet helping from an environmental perspective, yes, it would work. Tips for teachers to handle in the classroom, I have already explained. My son has completed 3.5 years, is doing OT speech, and should we increase the therapy? Well, I think as long as you're doing therapy twice or thrice a week, that's more than enough. I don't think you can increase the therapy. So that's that. Can an adult with autism take up a regular profession? Well, he can if he's trained and he has a normal IQ, definitely. But the people at the workplace will have to adapt to him. Is it good to develop a particular syllabus for ASD to improve academic skills? Donna, yes, you do need to have a specific syllabus. You'll have to work with the school to probably decide, that, and that's how you'd probably have to work and see. Some of the questions are being repetitive. Sarla wants to know, do children fit into inclusive education after OT? After OT, speech and remedial, they definitely fit. Yes, no doubt. If a child with moderate ASD, the parents are willing to start only one therapy due to money constraints, what would you want them to start? Well, I think they can learn to teach the child at home. So I would put my money on occupational therapy. They should start occupational therapy, and then later they can do occupational therapy at home and switch to remedial education. Shruti wants to know which therapies help the child come out of the spectrum. There's really no therapy that helps the child to come out of the spectrum. Vijendra asks, is craniosacral therapy helpful? There are some reports of it being helpful, but it really depends on the therapist more than anything. Can a child with autism having speech defects improve? Yes, with good speech therapy they can. If they've not had speech for many years, it's difficult. It's really confusing because homeopathic doctors say that therapists don't have a permanent treatment for ASD, and that homeopaths, and I'm saying that homeopaths don't. What we really, parents don't know what path to follow. The path is follow a path of therapy, school, education, and if needed, visit a consultant, psychiatrist, or a pediatrician or a neurologist, and I think they'll be able to help you out. Someone says that they have a child 3.5 years old working on therapy. They feel he is not able to speak because of his eyes. His eyes are fine, but there seems issue in converting what he sees. Well, I would suggest meet an ophthalmologist, get a visual assessment done, and then take a call. Mamta wants to know whether music therapy helps. Yes, they do help. Jazila asks about the role of medication. I think I've already spoken about that. As of today, do any diagnostic tests remain for autism other than assessment? Sadly, no. Sports are also useful. That's what Swati has asked. Yes, they are useful. Would you say that a child with autism is better going to an inclusive school or a special school? I believe there are two types of children, some that fit better in a special school, some that fit better in an inclusive school. It would be on a child to child basis. Riddhi has asked, do children with autism get into self-harm due to suppressed aggression? Not necessarily. Suppressed emotion can be a cause, and it could also be their need for sensory stimulation, which is there. Many people have repeated their question. Can a sugar diet lead to aggression in children? Not necessarily. That again is a myth. It doesn't really exist. Can technology help an autistic child? Sarla, definitely it does help. So you try different apps, different mobile apps are there, which can be help. My son is 16 years old and he doesn't want to apply soap. Is there sensory issues? Well, if he doesn't want to apply soap, try applying foam or lotion or something, and it could work. You need not always, use a bar of soap. He may not like the bar more than anything. Someone wants to know whether they can learn therapies. Yes, you'll have to look online and offline as to what courses are available. Can autistic children be social as well? Yes, Momita, we have autistic children who can be social as well. Should autistic children have multiple caregivers? Better, because they should know how to deal with multiple people. Does India have a law for autism? No, but autism comes under the People with Disabilities Act, but otherwise they don't have a specific law for autism. How do we look at high functioning autism? Well, Ria, they have to be put in an environment which is conducive to their development. So you need to have schools, teachers, and people who can deal with their high IQs. Very, very important. Does a shadow teacher benefit? Amandeep, it varies child to child. Again, there are multiple factors that go into shadow teaching. Well, someone has asked me whether if they take up ASD as a special course for their career, will it be helpful? Well, Sneha, that depends on your personal interest and passion. I really can't comment on that. Vinay wants to know if vaccinations are responsible for ASD. No, Vinay, they aren't. So don't really worry about it. Sujata wants to know whether sensory issues can lead to behavioral problems. Yes, the both are interlinked. Can Down syndrome children have diagnosis of ASD is what Kiran asks. Well, some children with Down syndrome show autistic features. It's well known. So that's there. I end with my last question, which is asked by Dr. Nupur. Whether speaking in various languages with the baby affect speech and does it get hampered? I don't think so. Children need to know multiple languages, so I don't think they get affected when you speak in multiple languages. What is very important is the child eventually picks up one as the mother tongue and he will learn other languages later. And everyone can learn more languages at any given point of time. I have had a large number of questions asked, and I thank you for being there. I thank you for all the questions asked. If there's anything further you want to know, you can get my email from Autism Connect. You can get my email from my website, the Sousa Foundation, and you can email me. I'll be more than happy to answer your queries. It's been a pleasure being here. I thank Autism Connect for having me here, and I would love to be back again. I wish you all the best. Being Autism Awareness Month, I want all parents to know that I'm always with you, and I always understand the struggle and the troubles that you're going through. And thank you for listening to me. Have a good day, and God bless you.